All right, go ahead.
Good morning, everyone, and welcome to the 2020 Utah Housing Coalition Awards Ceremony. I'm Christy Chambers, and I'm the Vice Chair of the Board, and I am just thrilled to announce our keynote speaker today. Her name is Mikelle, as you probably all well know, and she will be talking to us about housing and healthcare. Take it away, Mikelle.
Oh, thank you, Christy. What an honor it is to be with you, and I want to congratulate all of the awardees today. I hope in my remarks I can share just a little bit of perspective on how Intermountain Healthcare and healthcare generally is thinking about this relationship between housing and health. And as I do so, I want to acknowledge, first of all, that my perspective is just one perspective, and that it takes, I think it's so important that we have voices from multiple perspectives, giving voice, if you will, to the importance of housing as an important component of health and well-being in our communities, and that you all are doing so much to develop this space, and we are just trying to catch up and learn as we go. So in my role, where I'm Senior Vice President at Intermountain and Chief Community Health Officer, my job is really to ensure that we are thinking about how to wisely use our assets as a health system in collaboration with community assets to improve health. And improving health is something that is much more complex, as we're learning, than we may have thought in the earlier days of healthcare. If we go to my first slide, the mission of Intermountain is to help people live the healthiest lives possible. And when you think about that mission of helping people live the healthiest lives possible, we're a healthcare organization. So certainly core for our mission is the hard work our caregivers are doing every day, and particularly on days like today, caring for lots of sick people all across our communities. And yet, as we think about how to be a model health system and really try to change outcomes in health for people in the communities we serve and help transform health across our country, we recognize that when we consider what contributes to health and well-being, only about 10% of what determines our health outcomes or our morbidity or mortality is related to the health care we receive. So the other factors are really important in influencing our health. Issues of social and environmental surroundings, our individual behaviors, and as healthcare organizations, we believe we've got to be more cognizant of these other factors that are influencing health and well-being if we're going to be effective with the healthcare resources we're deploying in the healthcare field itself. So let's go to the next slide, and I'll share with you how we're thinking about this. If we use the analogy or metaphor of a stream, and we often hear this term upstream, downstream, what are we really talking about? We think of healthcare first and foremost as a way to impact people's health at an individual level. When you think about going to a doctor or a hospital or an urgent care center for services, you're counting on us providing you with excellent, high quality, affordable clinical care. And when we're doing that, we're really trying to correct for a problem that might have been created somewhere further upstream. And we aren't going to ever shy away from that core objective. That's what we're here to do. But we are beginning to think about the ways that we can think midstream and further upstream about the things that are contributing to the health conditions that you're presenting with in those settings. So at the individual level or at the midstream point, that really means thinking about not just the diabetes that you're showing up with, but how does the environment in which you're living contribute to your ability to manage your diabetes? So do you have a safe place to live that includes a refrigerator for storing your insulin? Do you have access to healthy food? Do you have transportation to get to regular appointments for managing your disease? Having this broader awareness of your individual circumstance is thinking further upstream at that midstream point. And we as health systems need to be thinking that way. We also have the opportunity to think even further upstream. We're at Intermountain, and like many health systems across the country, we're one of the largest employers in every community in which we work. In Utah, we're the largest private employer. In every community where we operate, our hospitals tend to be one of the largest employers and employers of good jobs in those communities. We have tremendous opportunity to influence the community environment in which we serve by influencing incomes, education, opportunities for economic development through the purchasing power we have as a major contributor in that environment. So we're thinking at that upstream level as well in the way that we're doing our work. And this relates very much to the way that we're thinking about housing. So I'll tie all of that together, hopefully, for you. So if we go to the next slide, I want to talk about the social determinants of health. These are these things that contribute, these factors, non-medical factors that contribute to health and well-being. And we've thought in a really practical way about this, looking at the research and the evidence about what contributes to health and well-being, and kind of laid out a framework for which social determinants of health do we feel we have the opportunity to influence and understand. And think about that at the individual level as we're communicating with patients and talking with them about their real life circumstance and their families, but also thinking at that upstream level about how can we have an impact on transportation, housing, education in the communities in which we serve. And so that influences our work. We know that this translates, if we go to the next slide, in very tangible ways to health outcomes in the communities we serve. And when we looked at this, I'll just share a little bit of a vulnerability perspective here. You know, Intermountain's been in existence since 1975 and have always been focused on we're a not-for-profit health system driven very much by that mission, guided by a community board who has always said that we need to be ensuring everyone in our community has access to health care regardless of ability to pay. So we've placed clinics in underserved communities, partnered with a lot of community-based organizations who are serving underserved to ensure that we facilitate access into our facilities. And yet that access still leaves us with a health disparity that's very real. When we looked at data points comparing communities on the west side to the east side, all along our service area, we found health disparities that are resulting in a difference in life expectancy of 10 years. Now, the communities I'm showing you on this slide have been hidden to protect the innocent, so to speak, but the data come from zip codes in our communities, and they're not unique. There are multiple communities along the Wasatch Front, in Washington County, where life expectancy is 10 years different. And it follows very closely along disparities in education, income, and other factors, these social determinants of health that influence our health and well-being. And as a healthcare organization, we really said, well, okay, if we've been creating access for all of this time and it hasn't produced these health outcomes, then what role do we need to take in trying to address these other non-medical determinants of health if we want to be a part of helping people live the healthiest lives possible? And so if we go to the next slide, we created a demonstration project about 2 years ago now called the Alliance for the Determinants of Health. We chose 2 communities in collaboration with partners at the state level and talking with different communities all across our state regarding where we saw opportunity, and interested partners who wanted to be involved in thinking about how we could look at the non-medical components of health, connect those better with healthcare providers, and try to transform everywhere we're working with communities all across our service area. We said, let's go connect the non-medical services with the medical services and make sure that we're identifying people's total needs at a family, medical needs certainly, but also their non-medical needs, and then wrap those services around them, give greater capability to all of the various service providers. We expected that we would improve health, reduce the use of emergency departments for non-emergency needs, and really address some strong, high behavioral health needs we saw in these communities as earlier term outcomes would be important in the work. And we are finding that we're making improvements, and we're also learning that there's some real barriers. So even with community health workers helping people navigate to solve problems in housing and transportation and accessing healthy food, while also stabilizing their medical needs, getting access to behavioral health for them to solve. So the first, if we go to the next slide, ensure that so that we have earnings to invest in those facilities in the long run. But while we're making those investments, we have projects that I want to share with you. The first is the Utah Housing Preservation Fund, which Intermountain has taken a lead role in structuring in partnership with Zions Bank, the Ivory Foundation, and Utah nonprofits, transitioning to market rates, hide by families safely, and then make sure that they are maintained at affordable rates into perpetuity. So far, with this Housing Preservation Fund, Intermountain has provided loans between 30 and 50% of it for changing availability of affordable housing across the communities we serve. Another example is an investment. Sage Valley is a 432-unit multifamily property in West Valley City with 216 units, also providing a support infrastructure on working families as well as education through investing. This is with the Utah Housing Coalition that influenced that on to a letter to Congress urging inclusion of the Emergency Rental Assistance and Rental Market Stabilization Act related to public assets development. And if you're not familiar with public assets development, this is really utilized. And so this research utilizes those public assets for community good. The idea being that public landowners can create and partner then in developing them. So Intermountain is really interested in this work because we see that opportunity to align the social determinants of health more closely with our public partners across our communities. Our hope is that the public asset development will improve our infrastructure in our communities in addressing those social determinants of health. Lastly, if we go to the next slide, our third priority is to further support programs for housing stability. We recognize that just creating affordable housing doesn't necessarily translate to stable housing for all people in our community. Amplifying this work that we're doing in other arenas, in policy making and improving the availability of affordable housing to ensure from time to time to be able to do so. And this year we're fortunate we are making a $45,000 contribution to the Utah Housing Coalition to conduct a study. That study will serve to better understand racial inequities in the way of creating stable housing solutions in these communities. Our hope is that that study further informs health, including housing. So if we go to the next slide, I'll just close by saying these are very early days for Intermountain in being involved in addressing the social determinants of health, addressing housing, and thinking about our broader role in understanding the full scope of in contributing to broader. So I hope my remarks today have spurts and opportunities.
We are just so grateful. So I'm coming to feel those as well. So determinants.
Oh, gosh, there's so many, and I'll say lessons learned often come from making mistakes, and I think we hear this. You're intending to serve, intending to help, and so. We've gotten some things right, I think, in about 6 to 8 hours in people's homes or hotel rooms, as the case may be, really understanding what their life experiences were. So we got back to that research continuously through the work and continue to check in on it. The second thing that I think that we've really learned is the importance of just supporting a community in what they're wanting to accomplish and get done. And we were, when we chose 2 communities to work on in the Alliance, part of the reason for that was recognizing that every community is different. And if we did this in just one community, we might not be able to extrapolate the lessons learned as well to our entire service area. And that's our hope, right? We want to, county wants to do is really different than what Weber County wants to do. And the people sitting around the table are different. The assets in those communities are different. Worried that they were going to be a station for a healthcare provider to have, and it's been a really rewarding experience for our caregivers. They are partners who want to meet these needs.
Community builders, so it's just exciting, and share your experience with that.
Well, thank you. I think, housing has certainly immediate needs that people are able to articulate and that community health workers are able to solve. We have a great infrastructure here in our people. Not that some of our local food banks haven't had refrigeration resources or public transportation for some of those mechanisms. But we're also right at the point that they're coming to get someone started on those services right away, and then connect them back to where to go next for food. And so I think we're trying to think, how do we meet that immediate need in that downstream sense, but also to all of those who are
easily solved. And once you identify them and solve them, then everything else seems to fall into place. So that's exciting to hear. I'm focusing on this.
Health systems should be building housing or shouldn't be. And I'll tell you, we have this debate amongst ourselves. Do you think healthcare is affordable? Affordability in healthcare is a determinant of health, right? Yes. So we have to be really thoughtful about how we're utilizing our assets. And that's why so far we've been saying, let's take our thinking about actual housing for some of our most expensive patients, because a roof over their head is cheaper than a hospital stay, right? But for the most part, we're doing that in partnership. And we have partnerships with several organizations that are housing people so we can discharge patients and continue setting. We have
partnerships and more fluidity within the community itself.
We should do it. But we're being thoughtful about that and trying to listen to what the community's needs are.
Very good. Very good. Last question.
Completely linked. Housing and health together completely. Thanks, Christy.
Very good. Thank you.
SB 34 Affordable Housing Modifications was a groundbreaking piece of legislation that was enacted by the Utah legislature in 2019. The bill is the first of its kind in Utah and requires 82 Utah municipalities to update their moderate income housing plans to include either 3 or 4 unique policy items to enhance the nexus between planning, housing, and transportation. The creative development of these menu options allows municipalities to tailor housing needs to their respective communities. 2 organizations that are near and dear to my heart, the Utah League of Cities and Towns and the Wasatch Front Regional Council, were pivotal in working on the development of legislation and its subsequent implementation. ULCT and WFRC worked collaboratively with many stakeholders during the 2018 interim session and the 2019 general session to craft a bill that is forward-thinking policy and that will have a lasting impact on future growth and housing in Utah. Both organizations served as a resource to the 82 affected municipalities by providing numerous training opportunities and guidance on annual reporting. They serve as a resource for housing policy discussions and provide reports and analysis on the menu items selected in implementation of SB 34 during 2020. These 2 agencies were able to come together for a common goal while sharing a collective vision for holistic community planning. They are staunch advocates for cities, housing, and good public policy, and are incredibly deserving of this year's Member of the Year award. Congratulations.
Greetings, everyone. I'm Cameron Dale, the Executive Director of the Utah League of Cities and Towns. And on behalf of our members across the state, I am honored and humbled to accept this award. Thank you to the Utah Housing Coalition for your partnership. We've done a lot of good work together over these recent years. We have seen record housing growth over the last few years, yet we recognize there is still a challenge for low and moderate income Utahns to acquire housing. In fact, in city halls across the state, mayors, council members, city leaders, community leaders, and business leaders are having these very important and difficult conversations about how to prepare for population growth, ensure housing, and integrate transportation planning with local land use and housing plans. We're all in this together, and thank you for recognizing that, working together with the Utah League of Cities and Towns, and for recognizing our efforts in this space. In 2021, let's keep it up. Thanks, everyone.
Hi, I'm Andrew Gruber. I'm Executive Director of the Wasatch Front Regional Council, and I'm so honored to accept this award for Agency of the Year along with our partners at the Utah League of Cities and Towns. The work we do at WFRC is designed to make sure that people's housing is coordinated with transportation so that people have access to opportunities for jobs and live their lives. And here's an example of that. I'm in front of the Exchange Place in downtown Salt Lake City. It's mixed income housing, and as you may have just seen, it's right by the tracks line on 4th South. So this is an example of something in Salt Lake City, but this is happening all over. Think about housing in relationship to transportation to give people those access to opportunities and reduce their overall housing and transportation costs. So thank you again for the award, but much more importantly, thank you for the work that you're doing. The Utah, all of the people in our region, and we're very, very honored to be partnering with you. Thank you.
Hello, I'm Sherry Whitwer, and I'm happy to introduce the 2020 Agency of the Year recipient, First Step House. Over the course of 62 years, First Step House has transitioned from being a true halfway house to a licensed, credentialed, and accredited behavioral health treatment and housing provider. 2020 marks a significant milestone for First Step House due to the implementation of new housing developments and the expansion of existing projects. These include opening 2 new permanent supportive housing facilities, Central City Apartments and 426 Apartments, expanding recovery residence housing, sober living, growing the REACH, Recovery Engagement Assessment Career and Housing Program, to 60 beds, and locating another property for permanent supportive housing development. The building includes the Charter Community Housing and Assertive Response for Treatment Enhanced Recovery Program, which provides on-site supportive services necessary for tenants living at Central City Apartments. The building also features an outpatient clinic that will serve those with mental health needs ranging from mild to severe. This project is the result of a partnership with Salt Lake County Behavioral Health, Optum Healthcare, Housing Connect, Blue Line Development, and many more. In January 2020, First Step House broke ground on the 420th East in Salt Lake City. First Step House and Housing Connect partnered on this new 40-unit complex to house and serve individuals, including veterans who have use disorders and mental health conditions. These 2 housing projects will also expand First Step House's target population by allowing them to serve more women and people who have a mental health condition as their primary diagnosis. First Step House will also relocate and expand the REACH program to a new 60-bed facility. This will create the opportunity to transition existing residential as recovery residents. Overall, First Step House is committed to continue expanding housing resources, developments, and case management services for low-income and vulnerable people in our community, including those experiencing.
Recognizing First Step House as the 2020 Agency of the Year. We don't say that casually. I don't say that casually because Utah Housing Coalition has, in many ways, been with us for a long time on the path to developing deeply affordable housing that meets the needs of vulnerable populations in our community. You have always been open and receptive to us as we've come to you recently and in the more distant past to talk about the barriers that the people that we serve face as they move into the community to find stable, supportive, affordable housing. Thank you. Thank you. Thank you. First Step House is in many ways receiving a lot of the recent attention because of the development of Central City Apartments, a 75-unit affordable housing project that is service rich. The only reason that that project exists is because of the support of this community that really rallied to help us get that project through all of the different layers that are required in the development of affordable housing. So thank you, Salt Lake County, Salt Lake City, Olene Walker Housing Loan Fund, Zions Bank, Housing Connect, Housing Authority of Salt Lake City, Utah Housing Corporation, Blue Line Development, Rocky Mountain CRC, and so many others. As an entity that is relatively new to the space, to the housing development space, you made it easier. And we very much appreciate that and look forward to working with the community to develop more housing for vulnerable populations as we move into the future.
Congratulations to the 2020 Urban Project of the Year, the Hub of Opportunity. Created in partnership by the Columbus Community Center and Housing Connect, the Hub of Opportunity is now open as Salt Lake's newest innovative transit-oriented commercial and residential development for accessible and affordable housing. The project brings together a unique combination of community services, workforce development opportunities, and community living. The 200,000 square foot building is located at 3900 South, West Temple, adjacent to the UTA Meadowbrook track station in South Salt Lake. The single condominium building includes 156 residential units, as well as mixed-use space designed to serve individuals with autism spectrum disorder, as well as the broader community. Most notably, the Hub is a high-quality project that provides housing that is tailored to meet the needs of the community in the following ways. 1. 110 of the units are restricted to serving individuals earning between 25 to 60% AMI, which helps meet the unmet need for affordable housing in Utah. 2. On-site residential services are provided to tenants with disabilities by the Columbus Foundation Incorporated to help them acquire independent life skills. 3. The Hub is a transit-oriented development located adjacent to the tracks line, which provides tenants to public transportation. Congratulations to everyone involved in making the Hub come to fruition and leading out on a truly innovative, affordable housing project for Utah and the nation. Again, congratulations to the Hub of Opportunity.
I want to thank Utah Housing Coalition for this award. On behalf of Columbus and in partnership with Housing Connect, we couldn't be more thrilled to be honored this year for the Urban Project of the Year. We couldn't have done this, of course, without the efforts of everyone in our community. I think that is what makes this project incredibly unique, is we did it with so many partners. Everyone from Utah Housing Corporation, who issued the tax credits, to the home credits that we received through the county, through the Olene Walker funds, through all of the philanthropic dollars that came in, this project possible. And so it is just remarkable to see a community come together that values inclusion and allows us to provide housing to really all walks of life here in Salt Lake City.
Good morning, this is Janice with Housing Connect. I'd like to thank Utah Housing Coalition for recognizing the Hub of Opportunity for Urban Project of the Year. The Hub is the result of a long partnership with Columbus community and really a labor of love. It's a 157 unit mixed income, and the real goal behind this project was to integrate individuals with disabilities into the community while providing affordable housing. Projects like this don't take place without a lot of support, and we had a tremendous amount of community support. I'd like to thank UTA, South Salt Lake, Salt Lake County, Olene Walker, Goldman Sachs, Utah Housing Corporation, American Express, and many, many others who helped us with the financing. We had a great team working on this project. Method Studios was the architect. R&O was the construction company. They did great work and never missed a deadline. Columbus, we couldn't have had a stronger partner in terms of their knowledge, subject knowledge, and their great depth in the community with support and ties. I'd like to thank a few individuals who really went above and beyond to help us complete this project. Troy Hart from our agency worked countless hours and was tenacious in putting together a very complex financial package to get the project built. Steve Graham was a consultant who went above and beyond. He helped us with New Market, but also just provided key support to Christy, Troy, and myself during. And finally, Mike Farrell, who was the owner's rep during construction, but also is our partner in property management for the commercial space. With that, I'd like to say thank you, Utah Housing Coalition, for recognizing the Hub of Opportunity.
Hello, everyone. I wish that I could see you all in person. I miss seeing all of you. My name is Mikelle Weaver. I work for Rural Community Assistance Corporation. I am a board member for the Utah Housing Coalition. And I just want to say, do you know what's really great? It's that despite this pandemic, despite the economic shutdown, the social distancing, we still are working hard to put housing on the ground. We still have organizations that are successfully building affordable housing to close the housing gap that we have in our state. I have had the opportunity for several years running to present the Rural Project of the Year Award, and I'm very pleased and honored to be able to do it again. The landing at 5 Points, located on the border of Harrisville and Ogden, is a family-focused 66-unit project that will incorporate units for extremely low-income individuals all the way to market rate rent units. The benefits of mixed income living really have included poverty alleviation, improved housing quality and neighborhood conditions for lower income residents, and increased tolerance for diversity for residents of all incomes. The landing at 5 Points is close to a range of walkable services and includes mountain views. This project leveraged several funding sources from 4 different lenders and included low-income housing tax credits. This patchwork of financing, I think, illustrates the commitment and dedication of the Neighborhood Housing Solutions team and their partners. One additional thing I just wanted to point out, many of you will remember that last year we gave the Jack Gallivan Legacy Award to the Executive Director from Neighborhood Housing Solutions that was retiring. Here we are, the very next year, awarding Neighborhood Housing Solutions with the Rural Project of the Year. And I think that is a testament to the new Executive Director. I get the pleasure of working consistently with Josh Runhart, the new Executive Director at Neighborhood Housing Solutions. I know he has done an outstanding job in a short amount of time, and I think that this really goes to show his efforts. So it is my honor and pleasure to award the 2020 Rural Project of the Year to Neighborhood Housing Solutions. Congratulations, guys.
Hi, my name is Josh Runhart. I'm the Executive Director of Neighborhood Housing Solutions. We'd like to thank you for the award for our Ogden project, the landing at 5 Points. We'd like to specifically thank Jake Williams, who is our project manager. He took the project from initial funding all the way through to completion. Kim Datweiler, our former executive director, who got the project started. Our project team was Cure Construction. We'd like to thank them for all the effort and work they put forward on this. Steve Keir, the project team, Doug, Marianne, and Roger, who are our field team on site. We'd like to thank all of our investors. We've got Enterprise, who's the tax credit investor, Utah Center for Neighborhood Stabilization, Rocky Mountain CRC, Olene Walker Housing Fund, and the Rural Community Assistance Corporation. We'd also like to say a special thanks to the Utah Housing Corporation and all of our lenders and investors that got this project to fruition especially considering the incredibly volatile market that we were facing in 2017 and 2018. It took a lot of effort to get this project built, and we hope that it will serve the community of Ogden for years to come. Thank you.
Built in 1964, the Westwood Apartments was an attractive community located in the heart of Murray. It was an active community with a central pool and manicured courtyards, making it a very desirable place to live. Over the years, as ownership changed hands, some owners chose not to reinvest in the community, and deferred maintenance became extensive. Property management became unresponsive to tenants, and the property, no longer a community, turned into a hotspot for illegal activity. Restore Utah worked for 3 years to gain control of the project. But finally, in the fall of 2019, when the property was in jeopardy of closure altogether, Restore was able to purchase the property and begin extensive rehabilitation. Restore makes it clear that without the support of strong equity and debt partners who were aligned with Restore Utah in objective and mission, the project would not have been possible. And it was completed without the use of low-income housing tax credits. At the time of purchase, 13 of the 64 units were not even habitable. With their partners, Restore was able to piece together the resources needed for a substantial rehab and made the units livable again. To bring Westwood back as a community asset while remaining affordable to residents, the revitalization strategy had to be comprehensive, including 4 key elements. Improve the community safety by addressing the criminal activity at the property. Preserve and extend the useful life of the property through functional and extensive improvements. Increase the community appeal through an attractive and modern color scheme. And finally, improve the resident experience with community amenities. Most important, perhaps, is that Restore Utah has been able to keep rents affordable to households at 65% of AMI. Westwood Apartments is an excellent example of the creative capital structure and grit that is needed to preserve naturally occurring affordable housing. Not only did they turn around a very troubled property, but it also remains affordable well into the future.
Thank you to the Utah Housing Coalition for recognition on our Westwood project. This was one where when we first looked at it, we said this one needs help. The condition that the tenants were living in at this project was just unacceptable. And although at a low rate, they really were living in conditions that were substandard, and something just needed to be done. But these are not really, we talk about them like they are projects, but ultimately it's about people. And we saw people that were in need there, but that's not where the people stop and start. Obviously, to get these kind of projects done, it requires lots of people. Our partners over at Rocky Mountain CRC and the financing they provided, John Montgomery and Nick Berger and Steve Nielsen, that was critical to how we were able to execute on this project. Our equity partners at Goldman Sachs, we've been partners with them for many years. It wouldn't be completed without them, obviously. On our team, Rich Beck and Chris Meyer have been living and breathing this project for months on end, and really, maybe obsessing is the right word about the details about how you get these projects right, because we really had to pull on all of our skill sets to get this one right. So I just want to thank everybody involved, and I know that in terms of the project execution, ultimately going to the project and seeing the tenants enjoying their living environment in a way that's appropriate, and to go there and see the kids playing at the playground, and to see people sitting at the park benches and picnic tables enjoying themselves in units that are at a proper condition, that really makes it all worthwhile. So thank you so much.
The Utah Housing Coalition is proud to present Mikelle Flynn with Person of the Year. Mikelle has been working in homeless services for over 25 years, and it hasn't been until this past year that she was named Executive Director of the Road Home. Mikelle has taken that organization and has gone through some rocky times. And I can't even imagine, having the job to close a shelter and now open up a new resource center, and then a year after that taking over operation of additional. I also want to bring up that we asked Pamela Atkinson to do this presentation, and she was honored to do it. But unfortunately, Pamela, her schedule is tight, and she's too busy doing her Mother Teresa activities. So Mikelle, I just wanted to let you know that Pamela is very proud for you to be receiving this award. So Mikelle, carry on during this incredibly stressful pandemic, and continue doing what you're doing and keeping people safe and off the streets. Thank you again, and proud that you received this award.
Good morning. I want to say thank you to Utah Housing Coalition, to the staff, Tara and Francisca, and all the members. Thank you for your dedication and commitment, your partnership and leadership. It's truly an honor to work beside all of you to advocate for and develop strategies to ensure that every person in our state has access to decent and affordable housing. It's a joy and a privilege for me to work at the Road Home, work beside our incredible team who strive to help people end their homelessness each day. There are more than 568,000 people in our country, nearly 3,000 across the state and 2,000 here in Salt Lake County that experience homelessness every day. In the United States of America and the state of Utah, we can do better. We can commit to ensuring that the most vulnerable people have safe, decent, and affordable housing. It would cost less and certainly create a stronger community than allowing many thousands of people to become homeless each year. Possible to adhere to all of the COVID-19 safety precautions. Without a home, how can you keep the social distance, wash your hands frequently, and keep away from others when you're feeling sick? Let's use this opportunity that we have right now to shift our systems and focus on ensuring safe, decent, and affordable housing for everyone, and reduce the number of people who show up at the door of a shelter in our community. Thanks again to all the Utah Housing Coalition members for the incredible partnerships and collaborations that we've created together to work towards this common goal of affordable housing for everyone in our community. We are a strong community, a strong partnership, and I'm proud to be part of it. Thank you.
I'm honored to introduce and excited to congratulate Representative Val Potter on receiving this year's Housing Leader on the Hill Award. I can't think of a more deserving individual. In addition to all the good work he has done at Utah State University, Val is a dedicated public servant and community leader. He has served as a council member and then mayor of North Logan, also served in the Cache County Council, and for the last 4 years, he has represented Cache County in the Utah House of Representatives. With Val's multifaceted experience and dedication to those he served, he proved time and time again that he truly understands the complexity of housing affordability, its effects on the economy, our neighbors, our cities, and the prosperity of the state as a whole. Representative Potter made affordable housing a nonpartisan issue during his time on the Hill, which is a battle all in itself. He sponsored and passed SB 34 in 2019, which created the requirement for cities to create and maintain housing plans, the first of its kind. He also passed SB 39 in 2020, which infused greatly needed dollars into both preserving and developing affordable housing. While $5 million may be just a drop in the bucket, it was a huge feat in 2020. Almost all new money allotted during the session was scrapped once the COVID pandemic hit. Val fought tirelessly to maintain that money that he'd worked so hard to secure because he knew the value it had to our state. Although Val will not be returning to the legislature this year, the work he has done on the commission and the important housing legislation that he has passed will not be forgotten. Congratulations, Val, and I hope our paths cross soon.
Hi, I'm Representative Val Potter, and I want to thank the Utah Housing Coalition for awarding me the Leader on the Hill Award this year. I appreciate those who are involved in housing and the work that they're doing. I've been a member of the Commission on Housing Affordability for the last 2.5 years as a member of the state legislature. I was co-chair along with Jake Anderegg, and I worked with Representative Joel Briscoe on the commission. I appreciate their hard work, and I also appreciate the members of the commission for their dedication to making things happen with the Commission on Housing Affordability. We really have done some good things in the legislature and in the state of Utah. We passed SB 39, which has been a very positive thing. What we've done is help the legislature and the public understand the issues and the crisis that's happening in housing affordability. And I'm grateful to have been a part of that for the last 2.5 years. I won't be returning to the legislature next year, but I'm grateful for the work that I've done with housing, and I hope to continue in some fashion, helping where I can. I also want to thank the home builders and the realtors, the League of Cities and Towns for the things that they've done to help us, and also Speaker Wilson and President Adams in the legislature for the effort that they put on housing affordability. Again, thank you for this award. I greatly appreciate it.
His legacy has spread exponentially. One person can change the community. I'm going to go broad the world, because what he does is contagious.
He probably had the least nonprofit experience, but his passion for making a difference really struck me hard.
Hello, welcome to Utah Affordable Housing Virtual Awards. Congratulations to all the recipients. Let me tell you a little bit about Marion Willey. I met him over 20 years ago at the Utah Housing Matters Conference. We hit it off right away, talking about how we could build affordable housing in Utah. We set up a meeting, and the next day we met at his office, which is at the time in the Lowell Apartments. I came in, and before we could make it into his office, one of the senior residents grabbed him by the hand and asked him if he could help her turn on her television. We both strolled into her unit. The sweet lady didn't know how to fix her television. It had been unplugged. So we got her set up, put away some groceries, helped her straighten up, and went on to our meeting. Phone call. Someone didn't have enough groceries. So we went to the store and delivered groceries to that tenant. Marion is someone who cares.
I met Marion a little over 25 years ago. I remember he was running Utah nonprofit, and they decided to move up to Seattle. And he came to me and he said, "Sharon, I want you to be on the board." And I says, "Marion, I'm on several different boards right now. I'm president of Utah Housing Coalition. And so he came back a week later and says, "No, you need to be on the board. Between CAP services and this, and meshes, we need you."
I met Marion in 1995. I was working at the shelter at the time, and one of our staff members went to work for Marion, and I met him then, and had the great opportunity to go to work with him in 1996. Greatest day of my life.
When I first met him, again, he was working for Utah Nonprofit Housing Corporation. Carl Anaway was the director, a great man. And Marion replaced him in time. And to see where that organization has come from there, he's brought that organization a long, long way. what a legacy, and we should be proud of him. He should be proud of himself. And thank you, Marion, for what you've done.
We have worked together for over 20 years, and I've never seen him not reach out a helping hand for those in need. That includes giving people second chances, people coming out of prisons, people who have been homeless. He's always looking for ways that he can serve the community. And this is reflected in the growth of Utah Nonprofit Housing Corporation, which started in the basement of an office building and now has its own beautiful two-story office and has grown the portfolio by over 2,000 units.
One of the issues is if they disagree, he says, "You're going to agree with me or I'm going to pull the hairs on the back of your neck." And that has been a theme for 25 years. You better go along with me or I'm going to pull your hairs on the back of your neck. So we have one particular resident that kind of has a hoarding problem. And the apartment is not really very good, but he will still go in and clean it. But to do that, he has a total hazmat suit on. He looks like an astronaut walking down, out of the apartment.
I remember Marion was trying to get some projects on his own done, and he came into us and was asking for money, and our bank people said, "Well, what's this car guy doing low-income housing for?" And we said, "He's not the car guy. He's a good guy, and we need to help him out." And so we had Marion bring in his piggy bank, and I think pledged a property or two that he had, and basically everything that he had to lend him this money and respected. So it's come a long way.
Probably one of the biggest changes that I saw in Marion to begin with was when he was married and he had 2 kids, 2 sons. Marion wouldn't fly or anything like this. He would never really went on vacations, didn't do a whole lot other than just work. After he had a family, all of a sudden he was going on cruises with them. I mean, they took him out of his shell. So that was step 1. Now with his grandsons, to say that the world evolves around them would be putting it light. I mean, the day they were born, they had a college education fund already. Yeah, I mean, they are his total life. And it's great to see him with them. They're just as delightful with him. I mean, they think he walks on water, and it's special to see him. They're really, he's totally out of his shell. He's now being totally married. The real focus for Marion has always been to take care of the least taken care of.
If he tells you he's going to do something, he does it. And you can count on him.
He was assisting this elderly lady, his adopted grandmother. Behind the scenes, nobody knew about it, but helping her with her loneliness, with her groceries, whatever she needed to help her at that stage of life. And I've seen him over the years helping several people. I do some volunteer work downtown now, and I was speaking with this gentleman the other day, and he said, "Marion found me when I was so desperate, helped me get into decent housing, And if he had not helped me, I would not be here today. So I think this is just a terrific characteristic of Marion and his love for people and his willingness to help no matter who they are.
Rehab, and it's for the working poor. That is becoming more and more of an issue, and if we can help with affordable housing, and Marion sees all that. The other thing I think is very strong about Marion, he has a wonderful professional team that he works with. He can network with anyone. Matter of fact, I counted, the last time I counted, there's over 100 different business partners that he and his team has been able to bring in as partners with Utah Nonprofit Housing Corporation.
He has done more for this community, and he's also done just as much in the community where he was born and where he lived, and where his second residence is now. People don't hear about that, but he has. Every one of his family members have been taken care of. He is just so compassionate with, he has a heart that also has a business mind, but he deals from the heart, and he just cares. You know, it sounds simple, but it is. He simply cares about everyone. The staff we have, we've gone from 3 of us to right now, there's probably about 140 in this span of time. And everything really does come. He has given us a foundation and a mission that we really do take care of people, provide safe, affordable housing. It's a mission that he lives by, and really all of the staff do. Let's face it, to deal with the great residents we have, you have to have a heart. And you have to have compassion, and you need to love it.
To see the things that you've accomplished, and I think it is great to see you get this award. Congratulations. Thank you, Marion. And look forward to hopefully another 25 years some way in this business, helping people as we can.
I have the highest respect for Marion, and he's very deserving. Made affordable housing his passion and actually his life journey. And I really believe it will continue to be that. I hope this isn't one of those where he'll retire right after. Hopefully that won't be the case, because I think he has made a big difference in this community. But Marion, congratulations, and we have all the respect in the world and love for you.
I'd like to personally thank Marion for all of his service to the community. Congratulations on this award. It's very well deserved. Now here's to another 25 years of building affordable housing in Utah. Thank you.
The one biggest thing, congratulation, that I can give him is, number one, to thank him for allowing me to be a part of that. He has taught all of us so much, and there's no better award that he could receive, because he does have a very strong, lasting legacy in this community with the tens of thousands of residents that we've had, because they all know him. They all know of him. The staff members that we've had that have come and gone, his legacy has spread exponentially. One person can change the community. I'm going to go broad the world, because what he does is contagious. The best thing I can tell him and congratulate him and thank him for just being Marion, everyone. And thank you.
Congratulations, Marion. We are so grateful for all the work that you have done in our community, and well-deserved Jack Gallivan Legacy Award.
Thank you, Terry. Thank you so much. Thank you, everybody. I'm humbled because I just see all these wonderful things that people are saying, and I probably get some other people say other different things, but I want to thank Utah Nonprofit, the staff, all the people that have, over the last 30-some years, have helped me get to this position. I mean, I can remember 30-some years ago, I was standing, could you loan me $60? So she wired me $60 from Western Union. And from that, I was able to get housing. It was a boarding house. That was a rooming house. I rented a room for $140 a month 30-some years ago. And from that, along the way, I've been helped. And so, to me, that gives you inspiration to help other people to get where they need. We see a lot of people every day that struggle in life, and paperwork's important. All those things are important. Actually, I don't like it, really. What I like is what you can actually do for somebody, and that's what I've been trying to do. And I appreciate every one of you, and my Utah, Mary Jane, and Western Region, and Utah Nonprofit. All of you have helped me and helped these other residents, and just people in general, even people that are not residents of Utah Nonprofit or Western Region, to have a better day. And residents with teeth or a car to get to work or something in that aspect. But I wanted to thank everybody for nominating for my family, my grandsons, and because they are a part of my life, and as everybody well knows that when they have grandkids. John Montgomery and Terry Gentry, and I think of John Montgomery when I did our first tax credit, it was the first HIV housing project in the state of Utah, and John Montgomery and Marty Henry helped us do that. I'm grateful for that. In 1992, we dedicated it to my brother that had died of AIDS. Actually, he was able to see the housing, so he was around for that, but that was the first deal we did in Utah for AIDS housing. Jackie Bolton, which is gone also. All those people have had a part in where we're at today is because of them and many, many others. So thank you very much for the Jack Gallivan Legacy Award. Thank you.
For our annual awards, and goodbye 2020 and hello 2021. It's going to be a good year. Thank you very much.